Have you ever gone in for a blood draw after drinking coffee but no water? You feel fine until they cannot find your vein. They miss on the first try or you leave with a bruise. I've been a phlebotomist for 4 years and I've seen this happen all the time. Patients don't realize how much hydration affects a blood draw, and they especially don't realize that coffee is not the same as water. Drinking water before a blood draw makes the process easier, safer, and less stressful, while drinking water only coffee can make it worse. Today I will explain the problem that happens when people are not properly hydrated, the simple solution that can prevent it, what that looks like in real life, and what you can do next time to avoid complications. Now that you know why this topic matters, let's talk about what exactly goes wrong when people don't drink water before their blood draw. Dehydration makes a blood draw difficult. Many people drink coffee but skip water before their blood draw, which causes dehydration. In the article by Jessica Turner, a phlebotomist, a health writer, dehydration makes your veins shrink, roll, or collapse, making it harder to get blood and increasing the chance of pain, bruising, or even fainting. One morning, I had a patient came in for blood work. She hadn't had any water, and her veins were hard to find. It took a couple of tries, and she ended up bruised and feeling dizzy. That could have been avoided if she just had some water before her appointment. The good news is there is an easy way to prevent this. You need to be properly hydrated. The American Red Cross also advises people to drink one full bottle of water, 16 ounces, 30 to 60 minutes before your appointment. That's just one regular water bottle. It helps your veins be more visible and easier to access. Turner also explained that hydration makes the blood draw smoother and less painful, especially when paired with staying warm and relaxed. And according to the Mayo Clinic, staying hydrated, staying warm, and staying calm all help your blood draw go smoothly. So based on the both medical recommendations and my own experience, patients who hydrate are easier to stick, the draw is quicker, and they leave without problems. Now let's look at the difference it makes when someone follows this tip versus when they don't. It'll make the blood draw easier. Imagine two patients. The first one drank water that morning. I find a vein right away. They don't feel much of anything, and they're out in 5 minutes. The second one only had coffee, and I cannot find the vein. I have to warm the arm, try again, and they leave sore and frustrated. One small difference, but a totally different outcome. What should happen next? Some people think it's fine to grab coffee before a blood draw, but what they don't realize is that it can dehydrate you. Whether you drink coffee or not, the most important thing is to drink a full bottle of water, about 16 ounces, 30 to 60 minutes before you go. And your veins will thank you. Skip the extra cup of coffee and drink water instead. If you are not a coffee drinker, great. But if you are, don't let it be the only thing in your system. Water helps your veins, your comfort, and your results. So dehydration can make a blood draw more difficult than it has to be. Staying properly hydrated is the key to making the process easier, faster, and more comfortable. Start making it a habit to drink water before any blood draw. Just one bottle can change your whole experience. You might not be able to control how nervous you feel about needles, but you can control how prepared your body is, and it starts with water. Thank you for listening.